Hey everyone, this is your host Chris Gouveia. Thanks for listening to the podcast. In this episode, we're going to be exploring how do I become a facial plastic surgeon. We'll explore reconstructive surgery, cosmetic surgery, and hear from two experts in the field. As always, feel free to go to our website, howdoibecomepodcast.com, for episode extras, and thanks again. All right, well, welcome to the podcast. Two guests for the first time ever. Julia Kerolus, who is a facial plastic surgeon assistant professor at the University of Illinois, Chicago. Also one of my old training comrades. We trained in Chicago together when we were residents. And my second guest, Dr. Babak Azizzadeh, a facial plastic surgeon from Beverly Hills, the director for the Center for Advanced Facial Plastic Surgery, also has surgical privileges at UCLA and Cedars-Sinai. So thank you both for joining me so much.
Thank you, Chris. Thanks for having us.
Thanks for having us.
Well, Julie, I'll start with you. You just finished training with Dr. Azizzadeh. So talk to me about the pathway for a facial plastic surgeon and what that entails.
So, most facial plastic surgeons, obviously, you go to medical school, and then after medical school to practice any medical specialty, you do a residency. I completed my residency in otolaryngology, head and neck surgery, or ENT. And then I did a facial plastic surgery fellowship with Dr. Azizzadeh in Beverly Hills. People can do facial plastic surgery fellowships from several different surgical residencies, but the most common path toward facial plastic surgery is through the ear, nose, and throat route, or the head and neck surgery route. Fellowship is 1 year, and residency is typically 5 years.
After 4 years of medical school, 4 years of college. So we're talking about a lot of years of training.
Yes.
All right, perfect. But at the end of that, a lot of interesting things that you guys practice. So, Dr. Azizzadeh, can you talk to me a little bit about what your breadth of practice is and what you kind of do on a daily week?
Yeah, I think facial plastic surgery is really an amazing field, and you can do whatever you like with it. If you like to do a lot of surgery, you can have a very surgically oriented practice. If you don't, you can, focus on non-surgical procedures in your office. You can deal with cosmetic procedures around the face, eyes, nose, or you can do major reconstructive surgeries and, transfer bones from the leg to fix the jawbone. So my practice is a mix of all the above. I would say on the cosmetic front, I have a really, I think, a great practice focused on rhinoplasty and facial rejuvenation, facelifts, Botox, fillers, etc. that I do. And on the reconstructive front, I really am passionate about kids and adults who have paralyzed faces, facial paralysis, and we do a range of procedures to improve their smile function, improve their quality of life, improve functional issues, because sometimes these paralyzed issues can result in drooling and difficulty, keeping liquids in your mouth. So it's a really amazing, breadth of procedures, but it's really focused again on facial paralysis, rhinoplasty, and facial rejuvenation.
Okay, great. And Julia, now that you've been out of training for a year now, how's your practice kind of developed and what are you most passionate about?
Yeah, so I do a good mix of cosmetic and reconstructive as well. I Since I did my training with Dr. Azizzadeh, I actually really loved how he had his practice set up. And the way that I am able to do that is through the university. I see a lot of facial paralysis and functional rhinoplasty patients, so patients who've had trauma. That really fulfills something in me to work with a patient population that is more underserved. And then I also have a private practice in the northern suburbs of Chicago where I do more cosmetic surgery, and I also do a lot of Botox or neuromodulators and fillers, so some non-surgical things that patients, especially patients in the younger demographic, are really getting more into now. So I do a combination of the two, which I really enjoy.
Perfect. Yeah, I think the word breadth really stands out. How did you become interested in this, Julia?
So during my residency, I at first I was really attracted to head and neck surgery because of honestly the people that I met that were in that specialty. Everyone that I came into contact with generally was very friendly and very nice, and I don't think that's a coincidence. I think that's because they really enjoy what they do, and I was really attracted to the types of surgeries that were done, all different kinds. But in residency, my favorite aspect of every surgery, no matter what I was doing, was always the soft tissue part or the skin closure part, just making everything look nice. And that's really early on what got me interested. And then the thing
Hmm.
that I really enjoy now is that, especially with the reconstructive, you're able to restore their functional problems, but also able to improve things aesthetically, which patients really are grateful for.
Sure. Babak, how about for you? How did you become interested in facial plastics specifically?
It was a circuitous route, just like I think most of us in medicine take to find out what we really love. But interestingly enough, when I started medical school, I never thought I would be a surgeon. I thought I was going to be an internist. And I was like really, really focused on thinking about problems and having these patient interactions and patient rapport and so forth. And then I fell in love with surgery, in my second, third year, and really, really enjoyed the head and neck anatomy. And just like with Julia was saying, kind of that really drew me into the field, and really head and neck cancer was really exciting for me. And I did my residency at UCLA, and that was a very, very heavy head and neck cancer program. But as luck would have it, right when I started, they recruited a really phenomenal microvascular surgeon, Keith Blackwell, there, and he was doing all these reconstructive procedures. And I had a few residents that were ahead of me that were interested in facial plastics, and they started a facial plastic surgery program at that time. So I ended up interacting with a lot of the fellows very intimately and closely. And it just kind of, head and neck reconstruction and, putting things back together really ended up being the thing that I was most attracted to. And I ended up, in Boston, and that really opened up a lot of avenues with my interest in exactly what I'm doing now. And I was really, really fortunate, to go through that. And I've really been, I'm grateful for all of these little steps in my journey.
Sure. And I think I'm curious about that next step, which is, finishing training and transitioning to practice. So can you tell me a little bit about what that transition was like now that you're in Beverly Hills and started a center, committed to advanced facial plastic surgery? Kind of what is that transition like, and how do you become quote, successful in this field?
Initially in residency and fellowship, I published a lot. I was very, very interested in actually going into academic medicine. I'm working at a university so that I could, train residents, etc. But I also knew kind of what I wanted to do, and it's exactly the practice that I have right now. And at that time, this is about 17, 18 years ago, I interviewed at Penn and some other really high powered academic programs, but they just didn't see the vision that I had. And they wanted me to kind of follow and do all the things that people were doing before me, which was not what I was interested in. And I thought, you know what? I think I could do it myself. And I knew Los Angeles. I came back here. I For the things that I wanted to do, I had to be in a at least have a hospital that was very, very, a very advanced hospital that would allow me to do microsurgery and so forth. So Cedar Sinai was perfect. I got involved with Cedar Sinai, and one of my co-residents, like you guys, Dr. Larian, uh, had already started his practice, and we were really close. So we joined forces. He was doing head and neck surgery. I was doing reconstruction, And I was able to develop relationships with,
Mm-hmm.
the house clinic and, other doctors to develop my facial reanimation program, and, kind of got the ball rolling. But the first few years, although I was busy, I didn't have a salary. I really financially, I was really reinvesting everything I was making. I was living with my in-laws with a new baby and no
Wow.
car in LA. So there's a lot of sacrifices for, that sometimes you have to take, or do to achieve what you want. But I got up and running, thank God, very quickly, and was able to, um, develop a fellowship program within 5 years with Dr. Nassif, because I had a very unique practice. And so I got my training. I was training residents. Residents were coming over. I was teaching medical students. I was going to the county hospitals and training residents and spending time with them. So I did a lot of the things that most academic facial plastic surgeons were doing, but I had my own autonomy. So it's been phenomenal. But again, there are a lot of ways that you could skin a cat, and that's you have to figure out what your end goals are and kind of head towards that and not get deviated.
Sure. I mean, you can certainly hear the passion you have for it. I mean, you're a busy person for sure, but I mean, it sounds like you're really enjoying every aspect that you get from your practice.
Yeah, I mean, and I think that's the most important thing. Uh, what I tell most medical students is that, look, you could be, the world's guru, pediatric cardiac surgeon, and be doing these amazing, amazing surgeries. But, after a while, those surgeries will be routine for you. And so you
Mm-hmm.
have to make sure that whatever you're doing, you love and you're passionate about, and, you surround yourself by great people. I'm very lucky. Julia is very modest, but she was like an amazing uh, fellow that we basically hold up still to today. Oh, this person reminds us of Julia. I mean, that gets said all the time. But our fellows are amazing. My colleagues who I work with, my staff. I try to surround, and again, if you surround yourself with people that have good character and you can grow with, then anything's possible. And also you can have a joyful practice and career and not get burnt out.
And Julia, how have you taken those lessons that you've heard from Babak and transitioned them into your own, starting of a practice out there in academics in Chicago?
Yeah, so I was obviously so fortunate to have such terrific mentors in Dr. Azizzadeh and Dr. Nassif. And not only did I learn so much about the field of facial plastics, but they're also both really savvy in business and in their practices. And I was able
Mm-hmm.
to learn so much from that because we really don't get any of that in academic training at all. I think that the passion that Dr. Azizadeh exhibits it's rings so true for me as well. I'm starting maternity leave and I really am sad. I miss my patients. I
Mm-hmm.
miss going to work, and I just really would do it for free. Like Dr. Azizadeh said at the beginning of your practice, it's all about the hustle. And my husband is also in medicine. He's still in training. And so we're pretty much living off his salary and putting everything that I make back into my practice. And I don't mind that.
Mm-hmm.
And like
Mm-hmm.
Dr. Azizadeh said, how he kind of had this vision for the type of practice, the type of surgeries that he was doing. He was able to kind of piece different things together, which is what I'm trying to do in in doing the academia side where I am employed and I work at the university, but also kind of having my own business as well,
Mm-hmm.
seeing cosmetic patients at a different office and just trying to see what works. I actually was at a fellowship interview and I told them that one of the questions that I was asked was, where do you see yourself? And I said, oh, I kind of see myself in a hybrid private private practice academic setting. And they said, well, I don't think that's possible. And I said, "Well, okay, well, that was a little bit discouraging, but I'm doing it, and it's very, very much possible." And uh, it's, I think, if 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 you want it bad enough, you can make it work. So
Can you tell me more about that navigation of the business side of facial plastic surgery? Because I'll tell you myself as an otolaryngologist, when I was looking at fields that I wanted to pursue, I think one of the most intimidating things about facial plastic surgery was the idea that if I wasn't an employed academic surgeon, that I would have to navigate kind of the plastic surgery NOS business landscape, which is being on Instagram and putting yourself out there and advertising to patients and really selling yourself. How are you navigating that? And then I'll go to Babak because he's obviously been doing this a long time. But tell me how you've been navigating that.
yeah, so that's a really good question, and it's something that I'm bad at. I
Mhm.
think self-promotion in terms of being out there and doing a lot of the sharing. I think it's really difficult, especially at the beginning, because my first priority is my patient, and
Mhm.
so it's really hard to keep an Instagram audience engaged, for example, when you're really trying to focus on the work that you're doing. And so
Absolutely.
obviously that's the priority. So that kind of falls by the wayside. But I'm also really fortunate. My sister is awesome at marketing, and she
Mm.
works for several startup companies, and will. She doesn't run my Instagram, but she'll give me feedback and say, you need to do this. And she'll teach me things that I have no idea about. But and then I also am really fortunate to have a phenomenal partner in Chicago who is a plastic surgeon who's been in practice for about 20 years, and he really knows the landscape of marketing and stuff like that. So he has been helping me navigate those things. So again, the mentors that I have are really um, terrific, and obviously being in Beverly Hills and seeing Dr. Azizzadeh and Dr. Nassif, I mean, they're so successful in what they do, and also in marketing. I take tidbits from them all the time.
Babak, tell me more about what you've done for your own practice.
So there's a trade-off, and I think you have to look at your personality of what your goals are. If you're someone who is interested in, creating something, developing something, and building something, then that's going to be more like a private practice setting. And marketing is an important part of it, but it's probably only 5% of it,
Mhm.
because the majority of it is you got to provide good care, you got to provide compassionate care, you got to have the right staff, you got to have the right approach. And yeah, there are some people that are marketing wizards, and they will, and not great doctors,
Mhm.
and they just, they have a lot of people coming and going, but no one's staying.
Mm.
And that's fine. I mean, we can't control how people are in this world, but in private practice, I really do believe at the end of the day, it's not so much about the money, but it's more about like what do you like to do? Are you interested in building something? Are you interested in the management of many people? Are you interested in, you know, sitting down with staff and strategizing growth? Are you good with, being able to fire someone? I
Mm.
mean, that will happen, or letting someone go. Um, so it's quite different. Marketing, believe it or not, is probably the least important thing. It's definitely a part of, especially plastic surgery, or almost everything. You have to have, really, at the end of the day, develop great patient rapport, patient care. And if your patients are happy, all of those things will fall into place. If your patients are not happy, it doesn't matter how good you are. I mean, you'll make money, but you're not going to have a very fulfilling practice.
Can you tell me about some of the pros and cons that you have for the field of facial plastic surgery?
I mean, I honestly, I find almost no cons with it,
Mm.
to be honest with you. I
Mhm.
really, really think it's uh, it's one of the best fields in medicine. You have, quality of life. You can have independence. I think like every surgery I do is has some challenge to it, and it's different, and it doesn't get monotonous, and it's constantly evolving. At least the practice that I have, even, I've been doing rhinoplasty for 18 years, and still every one is
Mhm.
challenging. every one, I'm like, oh God, what was I doing? What did I do here and
Mm-hmm.
there? Same thing with all
Mhm.
the other, procedures, the facial reanimation procedures, facelifts, even Botox and fillers. So I think it's amazing. I honestly I don't find I think if if you like medicine, if you like developing relationships with patients, you improving people's quality of life. I mean, it has everything that we go into medicine for. Of course, there are aspects to it that are, to a lot of people on the outside, is superficial. Oh, you want to look younger, people are starving. Of course, there are a lot of factors of that, but we're here to help people, improve their quality of life, feel great about themselves, be out there, and, whether they're 70, 50, 30, or 15 years old, be able to, enjoy, the life that, they have to the best that they can. And a lot of times we're also restoring people's function back to where it was because something happened to them or something they were born with. So, I honestly, I can't find something that's at a fault,
Mm-hmm.
or negative about it. I love the colleagues. I think the majority of the colleagues that we have, Julia and I have in facial plastics, they're wonderful. You could do research, you could do basic science research, you could do clinical research, you could do philanthropy like Julia and I do. You could do the business side of it, you could do the non-business side. So I think it's really, um, I honestly, I don't think there's anything that I would say, oh my God, that's a negative about it.
I don't want to put Julie in the negative Nancy spot for naming a con, so I'll transition to my more rapid style questions unless Julie has something she wants to say there.
No, I was gonna say, couldn't agree more. I I used to be the person that they put out in front on residency interview days
Mm.
because there's not a
Why
bad
am
thing,
I
even I
not
would say about
surprised?
residency. I know because I was just like, I just love residency so much. And my husband, when I would come home from work, like, why do you like it so much? And you know, he just couldn't understand. And obviously, I feel the exact same way, even more so now, that I have some control over my life.
Hmm.
But I
Absolutely.
just love it so much. Yeah.
Okay, well, we'll just build on the positivity then. So I'll ask you first, Julia. What's the most rewarding or fun case that you enjoy if you had to choose one?
Oh, that's a really good surgery. I honestly, I will say, and it'll probably change, but at the moment, I really enjoy doing eyelid reconstruction for facial paralysis. And
Mm,
eyelids specifically because I've done several in the last few months, and the patients are so pleased because when you
mm,
can't close your eye, you can't protect your eye. So they're constantly dry, constantly tearing. They have to cover their eye when they're walking outside. They have to tape their eye closed at nighttime. And so it's a real significant burden. And it also, if they're unable to do those things, there's a real chance that they could lose their vision or harm their vision. And so, uh, and a lot of times they have a deficit that's visible as well, not in the inability to close their eye, but a lot of times their lower eyelid is really droopy. So,
mhm.
doing a combination of surgeries on the upper and lower eyelid to help achieve that closure and again restore that form and that function is lately has been really awesome for me. So
Perfect. Babak, how about you?
I go through phases, and it just tells me that, that's why I like having a mixture of different, areas within facial plastics. Obviously, there's nothing more gratifying than helping a young child who has, a paralyzed face or some sort of facial a difference, uh, you know, be able to go to school feeling great about themselves. I mean, that ultimately, you're providing someone for 80 years maybe of meaningful improvement in their life. I have the privilege of helping kids in that way really makes me probably the most excited, and innovating.
Mm,
And I think that it's kind of cool because we're still, almost every aspect of medicine, regardless of what you do, is probably in the, very infancy of where it should be. So we still have a lot of room for innovations, and those things we're, continuing to strive for. So the innovation is cool because that keeps, the intellectually stimulating, but really helping, I would say, kids and young adults probably is the most meaningful um, procedures that we embark on.
So we've talked a lot about, reconstructive surgery and, the help that you guys are doing for quality of life. So does it bother you how plastic surgery, is portrayed in the media and pop culture? Like you said, there's a lot of starving kids, this focus on faceless and fillers and Botox. I think that's how many of us here, not in medicine so much, but in the popular media. So does that bother you at all, with this being your line of work and you guys having so much passion for the reconstructive and the quality of life side of things?
I can answer, and then I would love to actually hear what Julia thinks because Julia, is younger for sure. uh, but y- yes and no. I mean, I think again, you got to be focused on who you are and
Hmm.
what you're doing. I think in every field and every there could be something or someone or some aspect of it that could be misconstrued. And right now with social media, almost anyone can have something that they
Hmm.
don't like
Hmm.
about what they're doing. So yeah, I mean, I'm in Beverly Hills, and believe me, I'm very, very different than most of my colleagues here. Plastic surgery definitely is in the spotlight, which is good because that keeps attention on it. And those patients, there are a lot of people who need your help that today are doing procedures maybe 20 years ago they would be ashamed to do.
Yeah.
So it has opened up a huge avenue of, people that need help. And whether it's cosmetic or reconstructive doesn't really matter.
Julia.
Yeah, so in terms of the stigma or people thinking that, "Oh, it's why would you have that done?" It really doesn't bother me because the majority of the time, if someone says that directly to me, usually my response is something along the lines of, "Yeah, but it's kinda like getting your hair dyed." You
Mhm.
know, there are things that you could kind of relate to them, um, and everyone does things for their appearance, everybody, and 'cause that's normal, that's part of, um, human interaction, I think, is to kind of take pride in your appearance, and, most people, after I say that, they're like, "Oh, yeah, I guess," and the other thing is that a lot of people are, getting a treatment or, even if it's non-surgical,
Mhm.
they're having something done to kind of maintain or enhance their appearance, and so I like I love to normalize it, and in my everyday life too, if a family member or a friend asks, I just like to make it normal, and like Dr. Azizzadeh was saying in terms of it being in the media and people having things done, um, m maybe at a younger age, I really don't see those kinds of things, those negative things actually in practice.
Mhm.
Uh, so, it really doesn't bother me as much.
Alright. With your, expertise, your collective expertise, if you, each had a friend or a family member considering cosmetic or reconstructive surgery, what would you tell them is most important when they're, considering a surgeon?
That's a good one because, sometimes we do have to think about that stuff for
Right.
things that we don't do because we just focus on facial plastic surgery. I mean, I think it goes back to, you know, the same way you're going to choose a doctor, right? You, plastic surgery is a little unique because uh, you have to have a physician or a surgeon that has both sides of their brain working
Mhm.
really intently. One side is, kind of what I call the engineering side, right? We gotta, electrical engineering. We gotta sew nerves together. We gotta do structural engineering. Elevate tissue and reposition tissue, and put cartilages in, and move, the tip here, or move the face here, or move the small muscle there. And then the
Mhm.
other part of it is an artistic side, right? Uh,
Mhm.
yeah, you could be a great microsurgeon, but if you don't have a sense of aesthetics and art, and normalcy and naturalness, you're not going to get great outcomes. You may have very few flap failures, but you're not going to get great outcomes. So those are the two things, and that's why I think it's important to know about the reputation of the doctor, what their track record is like, and I do think you can, with word of mouth, with a little bit online and so forth, get that. And then the other thing is looking at their before and afters and seeing if their artistic sense is in line with your artistic sense and goals. And today, it's not like it was even 10 or 15 years ago. Before we used to talk about so many things. We would say ethnic rhinoplasty. We would talk about gender factors, and now it's really very, very individualized. People will like different things, and it's not our job to tell them what to like, but we can guide them in terms of what will look good.
Hmm.
And their empathy is still very important, because if they're not listening to you, they're not going to give you what you're looking for. So if they're arrogant, they think, personality wise, you don't mesh with them, don't go to that surgeon. You could find someone else.
Yeah, I couldn't agree more. I think obviously the surgeon experience and their outcomes, their results are really important to look at. But I also tell patients that may have seen other doctors in the past in consultation or who are seeing other doctors. I think that connection that you have with them is very, very important.
Hmm.
If you don't feel like you trust them or you feel like you're not being heard or understood, even if they're the most talented surgeon in the world and you get a, an outcome that you're pleased with, you won't think it's as good, or you may not be as pleased because you have that difference with the surgeon, just on a fundamental level. And so I think when you're really looking or trying to find someone, you really have to find someone that you gel with and that you feel is hearing you and understands you and who's going to be there for you if something goes wrong or if you aren't happy for whatever reason.
This is a great, by the way, phenomenal topic and podcast, because first of all, we have time to delve into a pretty, complicated subject of what do you want to do, what's going to satisfy you, why do people go into various aspects of, different specialties, and I think it's much more complicated, but it's also very simple. No matter
Hmm.
what we do, in medicine, we got to really love what we do, and we got to treat people well, and we got to continuously learn about it and advance that field. And I think if, we think about that, whether it's cosmetic surgery or, cancer reconstruction or internal medicine, I think it's actually pretty similar.
Yeah, thank you for the kind words. I think the goal of the podcast is really just to hear from people in a variety of different fields and hear their passion for it to hopefully, inspire or at least educate people about, there being a wealth of unique and awesome opportunities for whatever might fit their, mindset, and at least hear what these people are doing and how they might fit into it. So I think the passion for both of you really stands out, and that kind of fills that for this topic of facial plastic surgery. So thank you both again, Julia and Babak. Appreciate your time.
Thank you. This is wonderful, and thanks for inviting us.
Thank you, Chris. This was so fun.